What's going on, guys? Spencer here. Today we're going to be talking about side lying and prenatal massage. I'm not only going to show you some effective massage techniques that you can do while your client is in side lying, but also talk about how to get very deep tissue in this position and the benefits that your client is going to receive from this massage. Prenatal is not only extremely helpful for the mother, but it's also amazing for the baby. And side lying is just an effective massage routine that can work if somebody cannot lay on their stomach or on their back. So let's go ahead and get started. First, you are either going to need a pillow and then a long body pillow. And if you don't have a long body pillow, 3 pillows work as well. The client will be laying on the small normal pillow with their head, and then hugging on to the long body pillow. Look at how excited they are for their massage. So we're starting off by just warming them up with light gliding strokes, applying the lotion. And side lying and prenatal massage has a lot of benefits. The big one is it's gonna help reduce their pain. As we know, a mom who is pregnant has a lot of pain in their lower back, their feet, their legs. It's not easy to be carrying around a baby. And so prenatal massage goes a long way in reducing their stiffness, their muscle tension, and their pain. It also helps to promote their blood circulation, so they're getting rid of edema and swelling by allowing the body to circulate correctly. It should also be noted that prenatal massage in no way harms the baby. It does not hurt the baby at all and is only beneficial for both parties. Though it is better to find a massage therapist who is trained in prenatal massage as opposed to one who is not. Now, as we continue, once we've warmed up, a big thing I see is that people are afraid to go deep tissue or use deep pressure in a prenatal massage. My advice is to, unless the client tells you that it's too deep, don't be afraid to get in at those deeper knots and deeper trigger points. Here I'm using my knuckles braced by my back hand, and we're really digging into her erector muscles, which are her spine muscles, and really working all around her shoulder blade or scapula. We're gonna be moving down to her lower back, and this is where I think side lying really shines, because you can get very deep into their low back with side lying, because there's an opening between their iliac or hips and their ribs. This is the opening I just talked about, and this allows you to get to their QL, quadratus lumborum, and that muscle is always extremely tight, especially for women who are pregnant. Don't be afraid to sink in at this lower back attachment and really hold the muscle knots and trigger points for a while. I generally hold really tight muscles for 30 seconds to a minute before releasing. I'll then follow up any deep work and specific work with more of a broad pressure, although it's still fairly firm, which is why I'm still using my knuckles and palms. But once we're done with the knuckle work, I'll then do more of a circular effleurage with my hands in order to come out of the deep work and relax them. You can also use your fingertips to push their spine muscles away from their spine, and that's a good way to also give back relief and pain relief. So I'm going to repeat those moves here a few times, just in the general warming up and getting rid of that tension. So I'm going to stop talking for this next bit, and I'll start talking again right around 13 minutes into the video to start explaining and going into depth about the neck and shoulder work that we're going to do during side lying. So see you guys there. So after we've done the back work, we need to move up to more specific neck and upper shoulder work. And here I do a lot of petrissage, which is a lifting, squeezing movement, as well as stacking my fingers, doing specific trigger point holds, and really finding the tight areas where the corner of your shoulder blade meets your neck. This is an area that creates a lot of tension, is the origin for a lot of headaches, so it's extremely vital to work. And this is an area that after it's been released, the client's gonna immediately feel more range of motion and more flexibility. But remember, releasing muscles is never a sprint, it's not a race, so just being patient and giving the muscles time to relax is a very key component in massage therapy. So I'll be doing more similar techniques to those I just listed, and always after working one side, especially with side lying, you have to flip your client and then do the other side, or else they'll feel really uneven. So make sure you hit both sides equally when you are doing a side lying prenatal massage. And the video is coming to a close. I hope you guys enjoyed it, got some relaxation, and picked up some techniques from it. Leave a like if you did enjoy the video, and consider subscribing for new content every single week. I will see you guys on the next video. I hope you all have a great rest of your day.